went from the bonnet, found face down on the floor.
2, 3.
Paediatric trauma
It's
call.
a stabbing quadrant.
25 feet from a ladder onto his back.
He's really unwell, and I think anaesthetics need to see him before he goes to theatre.
Daphne? Daphne?
How is everybody then? Chilling?
King's A&E, how can I help?
King's College Hospital, London.
I got stabbed.
I know, it's annoying.
My head.
One of the busiest A&E departments in the world.
I want top to toe, head, chest, abdomen.
A place where love, life, and loss
Don't bloody die. I love you too much for you to die.
unfold every single day. All the patients you're about to see were treated in just one 24-hour period.
A&E is always like a traffic jam. Can we get a trolley?
You've got to realise that there's awful things that can happen to you.
I'm so sorry.
Life is unpredictable, so it's important that your nearest and dearest know that you love them. You have to tell them that you love them.
You must get better and come back to me. I don't want to lose you.
Because there may come a time when you're not around to tell them.
I've got plaster, love. Yeah, fracture.
That'd be me who'd end up in hospital on Mother's Day, isn't it?
Adult stroke call, ETA 10 minutes. Adult stroke call, ETA 10 minutes.
Which cubicle can that go into?
6.
6.
It's Mother's Day at King's. Dr. Robeil is the consultant on duty in resus.
Okay, heart rate's come down a bit, that's good. When I'm at work, everything outside the hospital doesn't exist for me. Weekends are usually more unpredictable, but it was probably busier than what I expected. Okay, let's take some C-spine precautions as well for the time being. Yep.
Male or female? What is it?
What do we have? Yep. There are times when trying to figure out what's going on is incredibly difficult. Families do come into it because they're an extension to that patient, and they matter as well as the patient. Okay. I get incredibly nervous, especially when there's no relative or friends that comes along with them. It's Mother's Day, everyone should be at home cooking for their mummies. They're not.
Yeah, good, thank you.
Adult trauma call, ETA 5 minutes. That's an adult trauma call, ETA 5 minutes.
A builder is being rushed to King's by paramedics.
Right, let's prep.
23-year-old Jamie has fallen from the roof of a 3-story building.
So we need ventilator, we need drugs, we need propofol infusion. Fell 25 feet from a ladder onto his back onto a wall, complaining of severe back pain on Entonox. I suppose a bad day is when you have to tell a family member that their family has been hurt in a terrible accident, and you have to go and tell them and describe some of the injuries that they've had. And imagine saying that on Mother's Day, phoning up their mum and saying, your son's been in an accident, this is what's happened to them, and that can be incredibly difficult.
Trauma?
Here we go.
This is
is Jamie. He was up on the roof doing some roof work. It's a 3-storey building. He slipped off the roof, tried to grab the ladder, but he's landed on there was like a 6-foot wall between the neighbours' gardens, and he's landed but right-sided and on his back. Excruciating pain, very pale, very sweaty when we got to him. But he's complaining of a lot of pain from his back, from here all the way down the middle, all round his right side, all round his shoulder.
Everything that we do can impact the patient's life dramatically.
Can you feel my touching here?
It's a lot of baggage, but that's why I go home and play computer games. People do have to find ways of go home and sometimes just forget about it and relax.
He is reluctant to take a deep breath in because of pain on the right side of his chest. He has tenderness over right anterior and lateral ribs.
Yeah, it is. You can use that like a 3rd floor onto a brick wall. That's impressive. It's a dangerous job. What we need to do is get you off this hardboard, okay? And then we can examine your back, and then what we'll do a CT scan of your back and your chest, okay? Right. We've got 1, 2, 3.
Then we will be off. You have to start unstrapping.
You don't move, we'll do the moving. I suppose when someone comes in and they've been in trauma and they're complaining of severe back pain, you're really worried whether they've done their spine and whether they've got spinal fractures.
Ready, brace, roll.
Take the board
Down
off.
an inch or so as the board comes out now. You're nice and secure.
You've got to be very careful because you move them the wrong way and that bony fragment could tear into their spine and cause them permanent damage.
Ready, brace, down.
Does anyone know you're here? Yeah. Your family and someone knows? Good. Okay.
Doctors are performing an emergency ultrasound to determine whether Jamie has suffered any internal injuries.
I'm sure he's just going to have a few fractures, isn't he? Either that or something horrendous. The worst case scenario is they've cut their spinal cord and they can't walk ever again, and that's something we're not going to be able to repair.
Crying now for 25 minutes, 20 minutes, 20 minutes.
4-month-old Weston has had diarrhea and vomiting for over 24 hours. He's been brought in by new parents, Nina and Jason.
I know. He keeps looking at me like, what? I know. Every time I go near him, he's like that. Come here. Oh.
Jason and I met via the internet dating. We met in a pub locally. I found the whole internet dating experience horrendous.
She says that she only really agreed to have a date with me because we lived in the same postcode.
We met in the pub around the corner and well, initially, actually, I wasn't bowled over, but he was a grower.
My first impression of Nina. Funnily enough, you know, they say never judge a book by its cover. I actually thought, and I've nothing to base this on, but I actually thought she could be quite hard work.
And I had in my mind that I wanted to get back in time to watch Jonathan Ross. So we came back to my house, which I wouldn't normally do, and we watched Jonathan Ross together.
We had a lot of fun for the next few weeks and just never really looked back.
Monster. It's better.
I'm not sure if you're looking for a different thing when you meet at that age, but you definitely know what you do and don't want.
I wanted to meet someone so I could have a child or try to have children. Having children became very important to me when I was in my mid-30s. Suddenly the panic sets in at like 35. You know, is it going to happen? Because I was 35 and single. My panic was largely around actually meeting somebody. unfortunately, Jason came along when I was 37, so just in the nick of time.
She's really, really good fun. She doesn't take herself seriously at all. She's got a great sense of humour and she can really laugh at herself, which is priceless, you know.
Happy Mother's Day.
I have another patient, I'm afraid. We've got a 23-year-old who was on a roof doing some roof work. He fell 3 floors onto a brick wall. So we wanted to get a CT, C-spine, chest, abdo-pelvis. OK.
Builder Jamie is being sent for an urgent CT scan.
2 of you on this side, please, just for the log roll. Ready, steady, slide.
Doctors are concerned he may have suffered injuries to his internal organs, as well as fractures to his ribs and spine.
It's a bit of a lucky boy. But I expected him to have a lot more injuries, considering how high he fell. I mean, he doesn't have very much bruising on the outside, but tender over his ribs.
Can we just take his head, or you
I'll take his head. When people do come in alone, it can be quite difficult. When patients have families around them, they do provide a big family support and emotional support. I'm coming, I'm coming. The way I kind of look at patients is that treat the individual as if they were your family member and how you would want them to be treated. Right, so they had another quick look. We're still waiting for the formal report. Only injury so far is you've punctured your lung on the right-hand side where all the pain is. Yeah. And that's probably because you've got a rib fracture there. What we need to do is put a tube in to get the air out. Okay? Okay? Yeah.
Any other good ones?
Yeah, he's got a hemopneumothorax.
From what?
That's the 3rd chest drain we've put in today.
Oh.
Don't worry, Jamie, I'm here to hold your hand. Jamie, it will be painful, okay?
Yeah.
I have to just... So you need to squeeze my hand as much as you can. Don't worry, you won't.
I don't think you ever grow out of wanting your mum or needing your mum. That's always there.
If I was to have a medal, it would be best hand holder. We'll tell you everything that's going to happen, okay? If you want to. If you don't, then just tell us all to be quiet.
Adults can be very vulnerable just as children when they're alone in the hospital. They can be equally scared, they can be equally petrified about what's happening. And you've got to put yourself in that position and appreciate what they're going through at the time.
So have you got any other hobbies?
Fishing.
Squish, squish, fishing?
Yeah.
My partner is a massive fisherman, you know. I haven't been fishing ever since when I went with him after a night shift. Someone was having a heart attack at the lake. So I feel like I'm a bad omen for the fishing, so now I just don't go. Squeeze, squeeze, squeeze. It's all right, you can squeeze harder than that. I can take it from the north. Squeeze, squeeze, squeeze. You're doing really, really well. Squeeze, 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 squeeze. I must say, I think that was the bravest chest drain I think I've ever actually seen. There you go, perfect. Are you feeling okay?
Yeah, feel right, yeah.
So you're looking a little bit peaky, sweetheart. Might treat you with a bit of painkiller now, you know.
Yeah.
What techniques do you know? Okay. So external rotation, boom.
So what does that do then?
Because you bring the scapula over the shoulder.
Find it. Okay, so you just force it there. Okay.
80-year-old Daphne has dislocated her hip whilst putting on a sock. She's come into King's with her daughter Jill.
I mean, it's not great to be in hospital any day, but to be in hospital on a day that's significant to you is probably a bit more of a downer. The veins are beautiful.
Oh, thank goodness for that.
Pardon?
I said, thank goodness for that.
I know. And to have that day taken away from you, it can't be what you imagined to happen when you got out of bed that day. Okay, sharp scratch. Well done. So what were your plans for today?
It's Mother's Day today, isn't it?
It is. Happy Mother's Day.
You wanted to trip out. You got one.
I don't think this was the one you planned, though, was it?
Really?
My mum is probably the strongest character in my family. She's a matriarch. Hello, any recess? She was very disciplinarian, very strict. Other people go home from work and they get the washing done for them, they get cooked for, they get mothered. I go home and I work at the takeaway. Every time I phone home, I get told it's been too long since I last phoned. There's always a comment about my weight. She'd probably be one of those people who'd call me after a hospital admission and say, by the way, I was in hospital for this, whereas I'd want to be there. How you doing?
Hello. You look as if you've got some bad news.
Well, you know the bad news.
It's dislocated.
It's dislocated. I'm going to speak to the bone specialists here and ask them their advice, because you're a special case.
You can see she's like the bionic woman with all
You
that
are.
metal there, yeah.
I'm not sure how much is bone, how much residual bone is there. Look.
Not a pretty picture, is it?
Do you cause havoc when you walk, when you're at the airport?
Go through the, yeah.
I need to ring my mum.
Yeah, you must.
You're very far away.
Liverpool.
Oh.
So yeah.
Yeah, he looks much better. He's not soiled himself since we got here. This morning, when I got up, I changed him 3 times in about an hour.
I changed him lots last night, so I just all watery. He kept doing the horrible farty sounds, and I looked and it was just
Comedy fart noise.
Weston?
Can you grab that?
4-month-old Weston is being examined to find out the cause of his diarrhea and vomiting.
Hi, morning.
Hi, how are you?
Just take a seat here. Hi, how are you?
She looks a bit brighter.
Yeah, okay. Yeah, tell me about him.
He was unusually windy for about 4 or 5 days. He did quite a bit of distress. Had a terrible night last night. He was awake every half an hour. And he's had really, really bad diarrhea. Huge. It was everything. He just comedy. He was head to...
But the diarrhea came first.
The diarrhea started, yeah.
Diarrhea. He's had diarrhea for 24 hours.
And today, the stool has been as watery and...
Oh, yeah. He's this much since...
Would you mind undressing him?
No, of course not.
We had to change him about 3 times in the night.
OK.
Weston is Nina and Jason's only child. He was born after a 2-year struggle to conceive.
You can't help feeling a little bit of like, when is it going to be my turn? You spend a lot of time being happy for other people, and just hoping that your turn would come and waiting to be happy for yourself.
He seems a bit better, doesn't he? He's definitely lost weight.
You think he's lost weight?
Which is probably much needed.
Yeah, of course, there was, you know, a few months when I shed a few tears, but fortunately, you know, Jason kind of cheered us along through the whole process, and yeah, we got there.
Nina's a brilliant mother. Absolutely adores him. You know, she can't do enough for him. She spoils him. She really does spoil him. I have to keep telling her off. You know, and she's always buying him. You know, Weston's going to be the best dressed kid in southeast London.
Hello, yes. You're trying to talk to me?
Yeah, he's quite a chatty little fella.
People do complain about their kids, you know, the lack of sleep. It doesn't bother me. He can wake me up 20 times a night. I don't care. I don't care how many nappies have changed. I don't care how many times he's sick. I don't care if my favourite dress is ruined. I'm just so lucky to have him.
I think it's very likely that he had norovirus infection. Norovirus, N-O-R-O.
Okay.
I'll go and get a prescription.
Lovely,
Yeah?
thank you very much. You can't not eat drink for 6 hours. You can't have nothing to eat for 6 hours.
Start shut his arm off.
You can just kind of just feel it when they're together. You know, how much she actually does love him. It'd be interesting, actually, to see what she's like when he starts being a little bit naughty, how she'll kind of discipline him. Because I've got a feeling that she'll be a terrible disciplinarian. I think she'll be incredibly soft with him. So that'll be my task, no doubt.
This way?
Okay, keys, sedation. The mask is there. So what we're going to do is give you some stuff to make you kind of a little bit drowsy.
Yeah.
Yep. And then we'll let the boys work their magic. All right? We'll give you some oxygen as well. That's all right.
In resus, doctors are sedating 80-year-old Daphne. They can then safely reposition her hip.
Yeah, OK, I'll wait over in the room, OK. Well, fingers crossed.
Okay, so we know where our airway trolley is if we need it. Okay. I'll give you a lovely mask to wear. Lift your head up. Forward. Forward. There we go. Is that comfortable for you? How are you feeling? Good? So we're going to give you lots of oxygen. You let us know if there's any pain or anything, okay? Okay, we're going to get started, all right? Okay, you're going to start feeling a little bit woozy, okay? Okay, relax, relax, relax. Are you okay? Are you all right? Relax for me, Daphne.
It's okay. I'm listening.
What's up?
I'm listening.
You're listening? Okay.
Yeah, I'm listening.
You're just making some funny movements at the moment. Daphne? You still with us, Daphne? Daphne? You still with us, Daphne? Daphne? There we go. CO2. Okay, we're just going to press on your hips, okay? Let us know if it hurts. I've got you.
Sorry about that.
That's all right.
Oh.
Well done, Daphne.
Yeah, that's not a real...
Daphne? Daphne.
I got great faith in you.
Okay, it's all done, Daphne. It's all done. It's finished. We've got it back in.
I'm very impressed with the staff at King's College.
Oh, that's lovely to hear. The older generation are very stoic. They definitely don't want to be a burden, but I think inside, everyone wants to be cared for. You'll remember this Mother's Day for a while, won't you? I think it's really important to know that someone has family support.
So you're all dopey, are you?
You just see people wanting to recover more or wanting to get better when they've got their family there and they've got the family there to support them.
I didn't even know it was done.
That's probably the
Were
sedation.
you kind of talking funny stuff when you were under?
Yeah.
I couldn't have an X-ray now.
Yeah, and then you had a little bit of a wriggle.
Did I? Oh.
As long as she didn't hit you.
Did I
No, she didn't, but you were wriggling and I was
give away any secrets?
No state secrets.
Jamie was brought into A&E after falling off a roof. Doctors performed an emergency procedure to re-inflate his punctured lung.
How's it going, mate? I'll check that out. I can't do the other one. I don't do anything.
Jamie's mother and the rest of his family have joined him in resus.
Mum, that place. Fell off a roof.
That's not good, is it?
It's not good.
The hurt's talking?
Yeah. It's hard.
Is he still in pain?
Yeah.
It's very difficult for any mum to keep their composure when their child has been hurt in a terrible accident. Even if you're 40 years old, it's still their child.
Be careful. This isn't the present I wanted.
I know, Mum. I'm so sorry.
Don't be daft. God, are you really in pain?
Yeah. I
Be
felt
strong,
nothing like
be
it.
strong. You're alive.
Yeah.
People should be with their loved ones, even if it is once a year. And yes, you should love your parents every day and tell them you love them every day.
I just crushed all my ribs on the right hand side.
They confirm that they're all broken?
Most of them, yeah.
Yeah?
Just one side?
Yeah, just my right side.
Does it put you off roofing?
Nah.
Nah. Do you want to go up or do you want to stay with the baby?
Thanks for all your help.
No, I'm coming up.
Oh, you're coming up, are you? Sorry.
Yeah. Can't get rid of me that easy.
Jamie is being admitted to a ward for further treatment.
Okay, in a minute. About 100 miles an hour. Oh. You having trouble with your eye?
Yeah.
What was it?
I hit it.
Oh, really?
Yeah.
So it's sore?
Yeah.
Oh, they'll look after it.
Yeah, I'm sure they will.
What did you hit your eye with anyway?
Hairbrush.
Oh, that's...
It's a long story.
Yeah, speaking. Right, brother, I'll be there in a minute. I just pull my breeches up.
Oh dear. You keep on losing your trousers.
No, you just think I'm a stripper, wouldn't you?
I know.
Not us.
74-year-old David has been brought in with his wife Margaret. He is suffering from dizziness and numbness to his arms.
Oh, excuse me.
For a couple of days before then, he'd been feeling swimmy. When he said that his hand was numb and he was still feeling giddy and he couldn't lift his arm up properly, then I thought, yeah, it's time to call somebody.
I'm just going to sit you up slightly, all right?
Yep.
And then I'm just going to test the movements of your face. Okay. And I want you to tell me when you feel it touching and if it feels the same on both sides, okay? So if you just close your eyes for me.
We've been married 48 and a half years. And the only times we've been apart is when either of us have been in hospital.
Have you noticed any difference in his speech at all when you're listening to him?
I haven't really noticed, but I'm hard of hearing. And
Okay.
quite often I've got to ask him 2 or 3 times what he said anyway, so... I went to work in the post office telephones, as it was in those days, on the switchboard. In the south, they were short of telephonists. David's mother worked as a telephonist at Victoria, and I stayed with Dave's sister because she had a spare room. And of course, David sometimes he'd come and pick people up from the station and take them up to his sister's.
You always feel better when you come in hospital, don't you? You always feel better when you come in hospital than you do when you're at home.
Sorry, what did you say?
Can you sit there so I can see you?
That's an idea. We'd gone to Blackpool for a holiday and we were walking along the promenade. And he said, how would you like to be Mrs. Catchpole? So I said, yeah, OK. And he said, we'll get married next month. I said, we can't get married next month. I said, everybody will think I'm pregnant. And we went to Blackpool for our honeymoon. We went to see some shows and there was wrestling and there's always something going on in the tower. I mean, we've had quite a happy marriage, really.
Don't.
I couldn't get out of bed now, we could have sex. He's definitely the right man for me.
Bernard, I'm coming. Right, yeah. House. Oh. I'm just getting on my bike. I'll get here in a week.
I can wait for a week.
I'm coming. I'll speed it up.
Don't speed it up. Take it easy, okay?
Oh, I'll take it easy.
71-year-old Bernard suffers from glaucoma. He's come into King's after running out of eye drops.
I'm getting it.
You're doing good.
Thank you, brother.
What brings you to King's?
Well, what is it? I've been without drops.
How did you manage to do that?
Because I thought the woman would order them. She didn't order them this time.
Okay.
Well, because she was going away for a bit on the side.
All right.
With her boyfriend.
Can I have a quick look in your eyes? Is that okay?
No. My eyes are not 100%.
And see, you can just sit straight. You happy with
They're
that?
not too bad.
Let's put it there.
Bernard has been with his wife Linda for 40 years. He now lives alone in sheltered accommodation.
Yeah, we are. Yeah.
Well, I met my wife. And she was a very pretty woman.
And this one now. Keep looking straight.
I used to go to the club.
and it was a social club, and she was one of the prettiest people there.
That's good. That's good. Okay. Thank you very much.
I said to her one day, "Do you want to come out for a drink?" No. So I said, "Well, all right."
Do you mind closing your eyes for me?
So anyway, she came up to me 5 minutes later. She said, "Oh, all right then, you have to be sociable."
So the boy done good. Okay, sir. I will find the medicines for you. Come along.
Okay, thank you very much.
Yeah, come, keep going. Take a right. Well done.
We decided not to have children. You know, so we must stay out there, really.
You can sit there.
Thank you.
No problem.
She had a psychiatric illness. And she's on 24 hours care. She lives in a care home.
Oh, thank you. You're a diamond. Like that.
I care a lot about her. But then I do wish I'd had a family.
This when I was using the fork yesterday as well.
What, Dad?
I couldn't feel the fork properly yesterday.
No.
I forgot to say that.
Does it feel as though it's improving, though?
My fingertips are numb still.
Yeah.
They're dead, you know.
In Majors, David is being monitored after suffering a suspected stroke. His wife Margaret called an ambulance after he complained of numbness in his arms.
Hello, love.
Hello, Elsie. We're just talking about your Jack.
Oh, you're cold, love.
Freezing out, babe. One of the doctors just put...
Their friend Elsie has come to visit David after hearing of his admission to A&E.
Do you want to sit down, Elsie?
No, you sit. I'll get another chair.
Go on, Elsie.
Elsie.
There's another chair up there. Sit down. How do you feel?
I don't feel too bad now. It's just my fingertips are...
Still numb, are they?
Yeah.
I don't know why you're here, though.
Well, what happened, Elsie, is on Saturday, his arm was numb on all his fingers.
Yeah.
So I was looking in the medical book. I know you shouldn't...
Well, whether you do or you don't.
But it said in the medical book that giddiness and numbness, it could be the start of a stroke.
Oh.
So they sent the ambulance.
Yeah.
I get all tensed up because I don't know what to do for him. I can't describe it. I just get all tensed up. I just, in case I'm doing the wrong thing. I just don't know what to do. Sometimes I think, oh, perhaps I should have gone into the nursing profession and then I would have known what to do.
All right, love. I'll see you. Happy Mother's Day.
David and Margaret had been married for 10 years before having a child.
When you think it's not going to happen, you kind of put it to the back of your mind. Best not to worry about it, I think. We kind of more or less given up hope, and there was two elderly ladies on the ground floor, Anne and Julie. And when we called in on her, she said, "Would you like a turkey sandwich with sage and onion?" I said, "Oh, yes, please." Well, a couple of days later, I started feeling terribly sick, and I thought it was the sandwich, but it wasn't. I was pregnant. So it was a real surprise. It was lovely, and he was a really happy baby. He really was. Every morning when he woke up, he used to have a big smile on his face.
Do you prefer being a mother or a grandmother?
Well, a grandmother, you can give them back when you're tired. but I enjoy both. Yeah, I loved having him, yeah. I don't like troubling them unnecessary, do you? But it's better that you were checked out.
I'll be glad to have a cup of tea.
You've had two. I've had none.
Yeah.
Bernard has now collected his eye medication and is waiting for transport home.
You still haven't got it?
No, yeah, I've got it, but I've got to wait for a cab now.
All right,
Yeah,
okay.
thanks
My
for-
job is finished.
Oh, yes. Thanks for doing your job.
But eat something.
His wife suffers from mental illness and lives in a care home.
Well, even though she's got her illness, she's still very, very nice. And it's so good, you know, when I phone her up and she's so pleased to hear from me. That's good, you know. And it gives me a purpose in life.
Mrs. Mop, excuse me. Can I borrow your mop? Thank you very much.
And who looks after you, Bernard?
Me? I think I'm all right. I think I'll get by, more or less. I don't mind being alone. I enjoy my company sometimes, you know, so I suppose that's, you know, I think that's fair enough. That's what happens in life, isn't it? Being alone.
How long have I been on those tablets, Margaret, for my waterworks?
Sorry?
How long have I been on those tablets for my waterworks?
I don't know. Time just goes so quick. Yeah, I suppose I am a worrier. In one sense, yeah. You think, oh, everything's all right until the next thing happens. He's my friend, and as well as my husband and best pal. Everything, really.
Stop breathing for a second.
He sits on one side of the room and I sit the other, and I go, love you.
Pa, pa, pa.
Da, da, da.
Da, da, da.
If you mouth colourful, it looks like you're saying, I love you. And sometimes I go, love you. And he'll say, yeah, you're colourful too.
I've had something called a TIA, or a mini stroke.
Oh, yeah.
Which is where temporarily there might be a little block in the vessel supplying a particular area of the brain.
Doctors have confirmed that David has suffered a minor stroke. He'll be referred to the stroke team and discharged to recover at home.
I would hate to be without him, I really would. Yeah. I don't know if I could go on without him, actually. I really don't.
Thank you very much for all the trouble. Bye-bye for now. Now it's a stroke, but it's not one really, it's just a small one.
I'll have to look after you better, dear. Perhaps I've not been
You've been
looking
doing it
after
for
you
48
properly.
years, love.
Sorry?
You've been looking after me for 48 years.
When you're younger, you think, it's not going to happen to me. It's all these things that creep up on you. You think you're not going to get, but you end up getting them, whether you like it or not.
It's just one of those things that happens. And it's gonna come, you've got to just live with it, sort of thing. Got to go as, 1 day at a time.
I don't want to be without him. I want to go first if there's anybody going. Or go together.
I hope we have another one. If we don't, life's going to be good anyway. You know, we've got a good one. We've got a good one, and I've got Jason, and that's it. I go and pick him up all the time. If he just moans, I have him in bed with me, but I love it. I love having him in bed with us. He kind of pushes us both to the sides of the bed. I need to learn not to spoil him, and currently I think I probably could be accused of spoiling him.
I used to have a crush on this boy when I was younger. And I always tell him he doesn't kiss as good as he did.